A bursa is a fluid-filled sac that acts as a cushion between tendons and bones in joints. Excision of Bursa procedure method. The physician makes an incision at the site and dissecting down to expose the bursa. The infected or calcified bursa is excised from the surrounding tissue. The wound is irrigated and the incision is repaired in layers with sutures, staples, and slash or stri strips. Excision, olecranon bursa. Ischial bursa. Trochanteric bursa or calcification. Prepatellar bursa. The physician excises the bursa by making a longitudinal incision and dissecting down to expose the bursa, the fluid-filled sac that lubricates the joint against friction. The bursa is excised. The wound is irrigated and the incision is repaired in layers with sutures, staples, and slash or stri strips. Excision of epiphyseal bar, with or without autogenous soft tissue graft obtained through same facial incision. The patient is placed in the supine position and a tourniquet is applied to the proximal thigh and raised to the appropriate pressure. For excision of the distal femur or proximal tibia, the knee is extended on a radiolucent operating table with the intention of resecting two rectangular areas, one on the medial side and one on the lateral side of the bone. Under fluoroscopic image intensification, a stab-wound incision is made laterally or medially at the level of the growth plate. On one side at a time, an osteotome is driven to a depth of 1 cm into the growth plate and rotated 180 degrees to create an opening in the epiphysis. An oval curette is directed through the hole to a depth of about 1/3 the width of the growth plate. The physician sweeps the curette across the growth plate to remove the rectangular area. If an excision of the epiphyseal bar of the proximal tibia or fibula is performed, the peroneal nerve must be protected. The proximal growth plate of the fibula is approached through an incision anterior to the fibula and exposed anteriorly by subcutaneous blunt dissection. The growth plate is identified by subperiosteal elevation and a rectangular area is removed with a curette. The tourniquet is released and hemostasis is achieved. A piece of autogenous fat from the subcutaneous tissue, though the same incision, or an inert substance may be interpositioned in the cavity allowing growth to continue in the epiphysis. The wound is closed with sutures. A tourniquet is a device which applies pressure to a limb or extremity in order to limit but not stop the flow of blood. It may be used in emergencies, in surgery, or in post-operative rehabilitation. Epiphyseal injuries. Growth plates and epiphyses are areas located at the ends of long bones, in which new bone is produced. The growth plate may be injured with greater frequency than injuries to ligaments and bones due to the fact that the growth plate at this stage is the weakest link in the musculoskeletal system. Epiphysis is a part or process of a bone separated from the main body of the bone by a layer of cartilage and subsequently uniting with the bone through further ossification.